In this video lecture in healthcare ethics, we're going to be looking toward the future and considering a couple of emergent issues and the related ethical questions and concerns. The first topic we'll look at is complementary and alternative medicine. Now, this is also called integrative medicine, and throughout the text, the author uses this acronym CAM/IM. I will often, just for brevity's sake, say alternative medicine and hope people understand what I mean by that. And it's best to give examples. The central idea is that these are outside the mainstream approaches to healthcare, many of which are, but not all, are thousands of years old. And these include things you may be familiar with or may not be familiar with, like acupuncture, Tai Chi, hydrotherapy, music therapy, massage, Chinese herbal therapy, and nutrition-based therapies. As I said, these are outside the mainstream from what you might typically get if you go see your regular doctor or a nurse practitioner. Now, as you might imagine or already know, the conventional mainstream medical community tends to be skeptical about a lot of alternative medical practices. Conventional medicine focuses on scientific, evidence-based practice. They treat the patient like a physical body with observable, verifiable physical problems, and they want to try traditional, or at least evidence-based, or what they would consider scientific practices in treating patients' symptoms and conditions. Whereas the CAM/IM, or alternative medicine approach, tries to integrate physical, spiritual, psychological, even energy aspects of the human person and apply those to treating the patient. The idea is that they want to treat the whole person. So these will often come into conflict because the conventional medicine, evidence-based practice approach will say that alternative medicine doesn't have any support from science for its practices and may even be harmful. And the alternative medicine approach will say that, well, conventional mainstream medicine does not treat the whole person, and they have a very narrow view of what healthcare is or even can be. So these views aren't always in conflict, but it's similar to the conflict we find when we discussed spirituality in healthcare versus evidence-based practice, where they sometimes, and maybe quite often, will come into conflict. And here we see that sort of thing happening again. Now, all that said, there is some research on complementary and alternative medicine, but the text actually discusses research on people's use of alternative medicine and who the people are and why they choose them. And you can read that for yourself. One of the more interesting results of this study was that um, the majority of the people who were using these alternative medicines and complementary medical approaches did not tell their healthcare provider that they were using them. And some of them are supplements. A lot of people use supplements nowadays, and a lot of the research on the supplements is not very strong, and some of them may be harmful, some of them may do nothing, and some of them do help. Same with things like yoga and Tai Chi, for example, on alleviating certain kinds of pain. Sometimes they work, sometimes they don't, but there still needs to be a lot more research done on some of these practices to see whether they have consistent, replicable results. Of course, when I say that, I'm coming from the point of view of evidence-based practice, a scientifically minded approach. So maybe people who follow this alternative medical approach may not think that that's the right standard to use for these sorts of things. And the text discusses several ethical concerns based around the ethical principles that we've been covering throughout the course and using in discussing ethical issues. I just want to touch on a couple. One, of course, has to do with autonomy. And when we think about patient ethics, that the person has the right or should have the right to choose what they want to do to themselves to help with their healthcare issues. Um, but an important issue related to this is what is known as informed consent. The person needs to have full knowledge about what it is they're doing. If they're taking a supplement or if they're trying a form of other form of therapy like yoga or something, need to know what the risks are and what the possibilities are as far as they're known for this actually helping with their problem. Of course, people are spending money on and time on these things and maybe disregarding other kinds of treatments that have been proven and that may provide them more help and more relief from whatever's bothering them. On the practitioner side, of course, we have the Hippocratic principle that combines beneficence and non-maleficence, which is first do no harm, benefit only. So as a practitioner, you may say, well, I don't know if I could recommend this because I'm not sure that it helps. But if I don't know that my patient is using something that might be harmful, I don't know what I can advise them. But by the same token, the practitioner may need to know more about some of these things that may actually help. And of course, there's what's known as the placebo effect, where if someone, it seems it's a very interesting psychological, psychosomatic phenomenon where someone believes that something will help them strongly enough. Interestingly, it often does help them. And so that's not a scientifically replicable kind of approach to healthcare, of course. But it is an interesting phenomenon, and a lot of supplements may merely have a placebo effect, but the fact of the matter is it is a real effect, but it's not across the board and certainly would not work on every patient. So again, those are just a couple of ethical principles and issues that are relevant to discussing complementary and alternative medicine. So we turn to another topic, which I just want to touch on briefly. We covered a lot of related issues to this topic when we talked about palliative care. And we're talking about the baby boomers. We're talking about this large group of people that was born after World War II, and the date range is considered to be between 1946 and 1964. They're called baby boomers because men came back from the war and hadn't seen their wives and girlfriends in a long time, and people just seemed to have a lot of babies, and this trend continued for a couple of more decades. And so there were a lot of people born in the United States and in other countries during this time period, and it hasn't been repeated since. And so you have a very large population that is aging and will eventually be in this group. That some may need palliative care, but there are other things that they will need, but they have a huge impact on the cost of healthcare, of course, and a huge political impact because of their needs and the fact that they're often more politically active than younger people. And there are a lot of ethical issues that come up around this, and I would just invite you to look at some of these here. As I said, there's crossover with some of the stuff when we talked about palliative care, and but there are some interesting points that are raised in this chapter, and it's just good to understand what the baby boomers are, and when someone mentions boomers, what they're talking about. So that ends this video lecture on emergent issues in ethics as we look toward the future. Cheers.